Hello parents, today I want to talk to you about a condition many of you hear about for the first time during pregnancy or soon after birth called PUJO or Pelvi-Ureteric Junction Obstruction. Also, I will talk to you about antenatal hydronephrosis and why postnatal scans are important. I am Dr. Kant Shah, Pediatric Robotic and Laparoscopic Surgeon, and let us start with what PUJO actually means. Inside the body, each kidney makes urine continuously. Then it is collected in a part of the kidney called the pelvis before flowing down through a pipe called the ureter into the urinary bladder where the urine is stored for a few hours, and when the bladder is full we get a sensation and we pass the urine. The point where the pelvis of the kidney joins the ureter or the pipe is called Pelvi-Ureteric Junction, and in some children this junction is very narrow or does not work properly, so the urine does not drain smoothly and collects in the pelvis first and then in the kidney eventually. This condition is called Pelvi-Ureteric Junction Obstruction or PUJO, or in America it's called UPJO. Over a period of time, if the blockage is significant, then the urine will accumulate inside the pelvis and eventually the kidney, causing a pressure effect and affecting the function of the kidney. The important thing for parents to understand is that PUJO is usually a condition present from birth. It is not caused by anything that the mother did during pregnancy. In most cases, PUJ obstruction or PUJO, if detected early, does not cause any permanent damage to the kidney. So now let us connect this to what many parents hear during pregnancy scans, which is called antenatal hydronephrosis. Hydronephrosis just means collection of urine in the kidney. Antenatal means during the pregnancy. In the pregnancy ultrasound, if the doctor sees that there is a pooling or dilatation of the kidney due to collection of urine, this is labeled as hydronephrosis. This does not automatically mean a surgery or that a child has a serious problem. In fact, antenatal hydronephrosis is very commonly diagnosed nowadays, and almost 80% of it resolves on its own after birth. However, one of the common causes of this is PUJ obstruction, which is why we have to monitor such babies very carefully. There are other causes such as reflux of the urine from the bladder into the kidneys, a blockage in the urethra in boys, or a temporary dilatation which may improve as the baby grows. When you as a parent hear the word hydronephrosis during pregnancy, the most important thing to remember is that it is a finding and not a diagnosis. It tells us that the baby's kidneys need follow-up after birth. This brings us to the postnatal scan. Many parents ask me, why is the baby not scanned immediately after being born? Well, in the first 72 hours of life, the baby's kidneys produce much lesser amount of urine, and hence the hydronephrosis may be hidden. So, we usually recommend the first postnatal scan after 72 hours or usually after 1 week of life. This scan helps us compare the antenatal scans and see if the swelling has reduced, stayed the same, or increased. If the swelling or hydronephrosis has reduced and it is mild, then we may only observe with further repeat scans at 1 month or 3 months. If the swelling is static and significant, or if it is worsening, further tests may be needed to understand whether PUJ obstruction is present and whether the kidney is draining well or not. The goal of these scans is not to rush into surgery, but to protect the child's kidney function. With proper follow-up, most children with PUJO do very well, and when surgery is needed and if it is planned at the right time, to give the kidney the best chance to recover. So, to summarize, PUJO is a blockage of the kidney at the drainage point between the pelvis and the ureter. Antenatal hydronephrosis is often the first sign seen during pregnancy, and postnatal scans are essential to decide whether observation or treatment is needed. Early detection, regular follow-up, and correct timing of surgery are the keys to keeping your child's kidneys healthy. So this video is a part of a series of videos on PUJO, hydronephrosis, and eventually the surgery called Pyeloplasty. So please do like, subscribe and follow our channel to keep updated on this condition. Thank you.